Bismillahirrahmanirrahim. I am Dr. Javed Iqbal Kokar, Professor of Forensic Medicine and Toxicology. And continuing with the topic of personal identity, this is the second lecture of this series. And the contents of today's talk will be that I will be talking about what are the parameters of identification, and then what are the methods which are used for identification purposes. As we know that the methods are I will explain it, that it is subjective, objective and third party method, and we'll discuss in detail how they are applied. Now regarding the parameters of identification, it is based upon number one, the general data, which means the name, age, sex, stature, religion, race of that individual. And then it also includes the dental data. Dental data means any dental listing of the teeth, that means the primary, the secondary, in which state they are, and if any anomaly is there which been corrected, that can be gathered. Then the skeletal data is also the appearance of the ossification center, the fusion of the epiphysis with the diaphysis, and various cranial sutures and the hip bone, and all this skeletal data helps as a parameter for identification, not only the age but also the sex and other characteristics. Then genetic data, and this genetic data is can be the personal characteristics or DNA and any other genetic which is inborn. Then the identification can be from trace evidence. That means any trace which is left over at any place, and identity of that trace will be leading to the identity of that individual. And the trace can be anywhere. It can be mixed up with the dust, with the mud, and it can be applied on the skin as nail scraping, on the clothes, or anywhere, any material which is left over at any place on the body of the assailant, on the victim, and on the scene of crime helps in identity. Then the photographs are also helpful. If the previous record is available, you can match and find out the identity. Similarly, the handwriting, the signature, the patterns are unique with each individual, and they are also helpful as a parameter. Then DNA fingerprinting or DNA profiling, that is the analysis of the DNA which is unique of each individual, and that is very surest and characteristic for each individual. Then dactylography or the Galton's method, this is the method of fingerprinting. There are two methods, the Galton method and the dactylography. Dactylography is the fingerprinting, and the Galton system is another method of identification. So these prints are basically of the finger pads, fingerprints, and it can also be the footprinting. And this is the surest method of identification. Then lip printing, the chiloscopy, this is also very characteristic of each individual. Poroscopy, that means the pores of the sweat glands on the palms of the hands, and they are also very characteristic for each individual. Then blood grouping can be helpful. These are the parameters, can be any, and there is an unending list because every parameter is unique to that individual. So these are the major which are used. Then height and weight proportionate of each individual. Anthropometry or Bertillon system, this is the measurement of various body parts, and this is also very characteristic. Then the tattoo marks, the persons get pierced, they get tattooed, and they are very characteristic and can help in identity of that individual. Then certain scar marks. Scar mark can be of some disease, scar marks can be of injury, scar mark can be of operation or surgery, and that is also helpful in identity. Then occupational marks, certain characteristic occupational marks, they are marked on the body, on the hands, on the other parts of the body, and they are very, very characteristics. Then pierced ears. Sometimes the pierced ears are also helpful in identifying a particular individual. X-ray of frontal sinus. If the X-ray of skull is available and it can be superimposed if later on found, and the pattern of frontal sinus is also very unique of each individual, because the shape of the frontal sinus is different in every individual, and it is very helpful in decomposed bodies. When the previous data is available, it can be superimposed and found out. Then certain miscellaneous characteristics or miscellaneous data like movement and the gait of particular individual, gesture, posture, personal belongings, photographs, voice recognition, handwriting and habits. So these are other miscellaneous characters having a uniqueness in each individual, in every individual. Now regarding the methods of identification, in this the forensic medicine plays a very important role in determination of the personal identity. And the methods which are used, they are commonly the three methods for establishing the identity of individual, and these three methods are the subjective method, objective method, and the third party. Subjective method means the subject is in front of us. Now let's talk about the third party. Third party is the most commonly used method at autopsy, and we know that the two parties are the examiner and the examinee, and the third person or the third parties can be any, and it can be a policeman, family member, the relative, the friend. So the third party other than the examiner and examiner is the third party, and he can identify, and he can be either the parents, the next of kin, family, the friends, or the police. The name of the third party identifier with the national identity card number and a relationship with the disease should be entered on the report. Whether it is a medical legal report or an autopsy certificate, it should be entered. Then the subjective method, as I'm telling you that the subject is in front of us and all the characteristic of that individual from head to toe, they are unique for that person. And every character helps in identity. So they are unique. And this subjective method of identification is applied when the third party is not available for the identification. And this is basically done with the help of the morphological data of the examiner, of the examinee. And this is collected by the medical person, that the doctor, he gathers the data, and the best it should be done at the time of medical legal examination. When we do the medical legal examination, to note down the morphological characteristics of that individual as the subjective examination. So the specific characters having relationship to that person should be recorded in detail. And the physical characters of the examinee and his belongings, it is also listed. The specific characters like the height, weight, any congenital anomaly, if you find out extra finger or web nail or any other deformity or anomaly, that should be noted down. And the personal belonging, which can be either the wristwatch, the spectacles, the cap, the clothes, or anything which is along with the body, that can be noted down and taken into custody for the as an evidence. At autopsy in fresh cases, bodies, this information can be unlimited. Extensive information can be gathered if the body is in front of you and the body is fresh. But when the body is putrefied, decomposed, especially when the putrefaction is in much advanced stage, then sometimes the body is mutilated or some parts are missing, then this information becomes a limited information. The parameters which can be applied in for the personal identification, they are usually classified into anatomical parameters, physiological parameters, pathological parameters, and genetic parameters. Regarding the anatomical parameters, the body as a whole, the age, sex, stature, height, weight, build, everything is noted down. And the anatomical parameters, the shape and design of the body part, the shape of the ear, the shape of the nose, shape of the eye, they are also very unique of that individual. So various body parts like face having a specific shape of eyes, specific shape of nose, lips, chin, cheeks, color of the iris, and so on. So there is long list of the parameters which can be gathered from the person in front of you. The hands and feet having the fingerprints on the finger pulp, and they can be gathered. Then the anatomical parameters can further be divided into primary and the secondary. Primary means the parameter which is present at birth, and secondary which the person acquires during the passing age. The any parameter on the body like the scar mark, the cut mark, the tattoo mark, or any other parameter which secondarily develops later on. So primary are present at birth like facial features, and the secondary which appear and develop in various stages of the life like the secondary sex characters. They also develop secondarily. Now when we talk about the physiological parameters like gait, voice, tone, manner of speech, it is also very specific and unique for that person. Then the pathological parameters like the scar marks, the marks of certain disease, contractures, eczema, and remnants of the scars of some calcified fibroid or any wound, any injury, scar. So these are the pathological parameters which can be specific for that particular person. Regarding the genetic parameters, they are characteristics in the blood groups and inherited morphological characteristics like the Bohr bodies and the Davidson bodies, which are the nuclear characteristics which are specific to that person. Similarly, the objective method. Now, the objective method means that any object having an association with the subject, and that can be his identity card, his passport, his driving license, wristwatch, glasses, clothes, spectacle, anything. The object having an association with the subject is the objective method of examination. So, using the morphological data and the personal belonging data, this is analyzed by the investigating officer. They isolate the specific character of that particular individual and find out the identity clue, then which will lead to the personal identity. Then if we find out a trace somewhere and we establish the identity of that trace through its blood grouping, through its DNA, then that identity of the trace will lead to the identity of the person. So any character having an intimate association to a person which may be in the body or in his belonging are sufficient to establish the identity, which means every characteristic which is unique to that individual, whether it is the subjective examination or the objective examination, that the any object belonging having to association with that person, that helps in establishing the identity. Like sometimes the person is fattest among the class or the shortest in a group, tallest in that group. So they are also the specific to that particular individual. The objective method is also very helpful in decomposed and mutilated remains, as I will told you, because they are when the third party and the subjective method is not available as sure as, then the objective method is also helpful. And for this, the material and remains which are available when we lack the facial identity, they are sorted out. Like the material can be biological and it can be non-biological of that particular mutilated or fragmented or decomposed body. And biological material, they are isolated, they can be tissued, they can be fluid, like it can be hair, nail, bones, and they help us in identity. And on these samples, you can do the physical examination, microscopy, radiology, and on non-biological material, maybe clothes or any other belongings. On clothes, you can look for the style of dress, the tailor mark, the laundry mark. They can be helpful in finding out the individual. Same biological material may be left over the clothes as trace evidence which is not decomposed and is preserved. So thank you very much. This is about the second lecture. We'll continue about the personal identity in the next lecture. Take care. Allah Hafiz.